Hello, everyone. Welcome to week 4 and chapter 4. This first video lecture is going to cover the fundamentals of health record content. Let's get started. And again, this is covering health record content and documentation guidelines. So what are some of the impacts of poor documentation? Well, basically, if we don't know a patient's history, we can't really make qualified decisions about how to proceed with a patient care plan. So it affects the history, the physical exam. We don't need to go through and do a complete exam all the time. And definitely what affects the medical decision making. The other thing, in addition to patient care, is the accuracy of the diagnosis and coding of the procedures. Without accurate diagnosis and procedure codes, this affects the reimbursement for the healthcare organization, right? And again, documentation standards. So before we talk about documentation standards, it's important to understand what a standard is. A standard is a set of principles, guidelines, and in many cases, regulations where individuals, or more often, a group of individual subject matter experts, come up with these guidelines or regulations in order to accomplish a common goal. In the case of documentation standards for healthcare, this is talking about the principles, codes, beliefs, guidelines, and regulations that cover healthcare documentation. So an example of this would be if somebody is admitted to the hospital and they're kept overnight and they have a 5-day stay, many medical staff bylaws, and we'll get into that, what a bylaw is, will dictate that a physician has to see the patient when they're in house and write a progress note. That's an example of a documentation standard. So these, again, the documentation standards that it controls health record documentation. We use progress notes as one example, but we have similar standards on discharge summaries that cover the content of a discharge summary, when it is to be completed by. Same thing with operation reports. A history and physical exam being on all patients who are admitted to the hospital. There are different documentation guidelines for what happens when somebody's admitted through the ER and so on. We have documentation standards in both paper and electronic health records. Both paper and electronic health records frequently make use of templates. Templates help to ensure that providers are documenting things in a standardized way to support patient care. And again, as time goes on, documentation standards have gotten increasingly complex and detailed. I can recall when I started in health information management was looking at an old Veterans Administration hospital record. Several of the patients had a combined history and discharge within the same document. You now virtually never see that. And a lot of this is because the increased focus on documenting what care has happened, so we can focus on patient care quality, appropriate reimbursement, and prevent fraud and abuse. The way to do this, of course, is to document things at a finer and finer level of detail. And again, documentation standards will vary depending on the type of health record and the type of health setting. There are different standards that are required. Insurance payers want to know certain things in order to pay a medical office, right? Frequently, Cigna will want copies of records if they're going to pay a claim with modifier 25. Licensing boards have documentation standards. Joint Commission, as we'll see later in this course, has many, many documentation standards. Their individual facility policies and procedures, and then, of course, medical staff bylaws, which we'll talk more about. The goals of these documentation standards is to ensure that we have complete health record documentation and it accurately reflects all the treatment that's provided to the patient. It supports appropriate reimbursement by documenting a complete record of the care that was provided to the patient. That way, we can code at an appropriate level of specificity to ensure that the organization is getting paid appropriately. The goal is to get paid appropriately by having things coded at the correct level, not higher than actually happened and not lower. We mentioned medical staff bylaws, and a lot of people may have questions about what bylaws are. Medical staffs are typically self-governing, and the bylaws are the rules of professional conduct that medical staff have to obey. They're enacted and voted upon by the medical staff and the ruling group of the medical staff, which is called the Medical Staff Executive Committee. Once the Medical Staff Executive Committee approves the bylaws, they're approved by the healthcare organization's board of directors. And these bylaws are used to elevate the level of patient care. We talked about the progress note, right? Nobody would want to be admitted to a hospital, stay for 5 days after bypass surgery, and the surgeon never comes by to evaluate the patient, right? So we have bylaws that asks that the providers come in and visit the patient, document their care and their progress while they're in the hospital. These are required by licensure organizations, in other words, the Oregon Health Authority, the California Department of Health Services, accreditation organizations like Joint Commission, and federal and state regulatory agencies like CMS. All of these require medical staff bylaws. And medical staff bylaws will vary slightly from one organization to another, right? Bylaws, say for a hospital that doesn't have labor and delivery, will look different than a hospital that does, right? Behavioral health medical staff bylaws will look different than a standard acute care hospital's medical staff bylaws. And when we talk about the medical staff, the first thing that comes to mind is physicians. But in addition to physicians, we have non-physician providers, and it's always good to keep that in mind. These can include PAs, physician assistants, nurse practitioners, licensed clinical social workers, psychologists, and many others. These medical staff providers may or may not be employed by the healthcare organization. But whether they're physicians, nurse practitioners, PAs, or anything else, they all have medical staff bylaws if they're going to be providing direct patient care that everybody has to follow. A term that you hear sometimes are medical staff privileges or clinical privileges. And what this means is it delineates the specific services and procedures that a medical staff provider is deemed qualified to perform at a particular healthcare provider organization. It's somewhat different than licensing. Licensing is given by a state, local, or federal office that's permission to do something. Privileges are done by the individual healthcare organization, by the individual hospital, right? And they have a department, the medical staff credentialing office, that vets medical staff members that are seeking appointment. The Centers for Medicare and Medicaid Services, or CMS, is the federal agency with the Department of Health and Human Services that oversees Medicare, the insurance program for the elderly and disabled, and Medicaid programs. And again, it's under the broad umbrella of the Department of Health and Human Services. Another big difference between Medicare and Medicaid is a state program. It's administered by each individual state, even though there are federal monies involved. As a result, Medicaid eligibility and benefits vary from state to state. CMS requires that medical staff bylaws be approved by the governing body of the medical staff, that they address the duties and privileges of each type of medical staff, and that they cover how the medical staff is organized and what qualifications need to be met by an individual seeking an appointment to the medical staff. An example of these qualifications would be board certification, licensure, and so on. CMS requires two things for healthcare organizations to get funding to take care of Medicare patient. One is you need to meet the conditions of participation. The second is their conditions for coverage. Accreditation is often conflated with licensure, and they're actually two different things. Licensure is permission from the state to do something, to practice medicine, to fly a plane, to open a hospital. Accreditation is a voluntary process. It requires periodic evaluation against pre-established written criteria that's known both to the healthcare organization and the accreditation agency. Healthcare organizations measure their compliance standards and they seek this accreditation for the reason of being eligible to be part of an insurance program, enhance their reputation, and provide better service to the community. Healthcare organizations that are accredited by an approved accreditation organization are typically exempt from routine state survey agencies. Many times, if you're deemed to meet the higher standard of the accreditation agency, it is assumed that you're meeting the minimal standards from the state agencies. And again, each accreditation organization has to go through its own CMS review to obtain deemed status. And that way they can evaluate these healthcare organizations for compliance with conditions of participation and funding requirements so they can be an accredited organization with deemed status. Joint Commission is one that accredits a variety of healthcare organizations. We normally think of them as being hospital-based, but they actually do much, much more. And they survey clinical and operational components. They provide education to healthcare organization regarding compliance. And on this next slide, you see some of the many settings that Joint Commission provides accreditation for. This includes ambulatory healthcare, behavioral health, same-day surgery, home health, hospice, hospital, laboratory, nursing care centers, office-based surgery centers, physician offices, and many, many others. There are other accreditation organizations. One that comes to mind that many student health centers have is the Accreditation for Association of Ambulatory Healthcare, AAAHC. There's also the Commission on Accreditation for Rehab Facilities, the CARF, and others. And again, state statutes, a lot of state legislation involves documentation requirements for certain types of health records. And it follows the same process as any other law, where it goes to the legislative bodies and then it gets signed into law by the state's governor. Finally, and I'll end here, the documents and data elements that a healthcare provider may include in response to a legal request and authorization, a subpoena, will vary from provider organization to provider organization. And this is especially true now with electronic health records, as they're normally embedded not only to the documents that support patient care, but administrative elements such as scheduling, purchasing, library, and others. And that's all I have for you for this first video lecture. Come back for the second one, where we'll talk more about HIM roles, we'll talk about authentication, and many other relevant topics to record content. Bye now.